Welcome back to Magic Moments with the Medicare Professor. It's Patricia Mitchell with Mitchell's Advisory Group Insurance Consultants, or Magic Insurance Agency. And this video is all about Section 4 in your Medicare and You manual. If you want to pause this video and go get your manual so you can follow along, please do, because we're about to get started into Section 4. In Section 4, it talks about the Medicare Advantage plans. And for years, I have done seminars at churches, at restaurants, I've even met groups of people at individuals' homes. And one of the first questions that I get from people is, why didn't I hear about this Part C? I always hear about Medicare supplements. And they always get them mixed up. So when I enroll someone in a Medicare Part C plan, they tell people they've got a supplement. Go call that lady, she can get you a supplement to your Medicare. Well, Medicare Advantage plans are not supplements. They are part of Medicare. So again, there are 4 parts to Medicare. There's Original Medicare, Parts A and B. Then there's Part D as in drugs, and then there's Part C, Medicare Advantage plans, which can come with drugs and other benefits. So, what are Medicare Advantage plans? Turn to page 57, and we're going to read some of these paragraphs word for word. It's not what Patricia said, it's what Patricia read that keeps you and I safe. So, let's dive into Section 4. A Medicare Advantage plan is another way to get your Medicare Part A and Part B coverage. Medicare Advantage plans, sometimes called Part C or MA plans, are offered by Medicare-approved private companies that must follow rules set by Medicare. Most Medicare Advantage plans include drug coverage. In most cases, you'll need to use healthcare providers who participate in the plan's network and service area for the lowest cost. These plans set a limit on what you'll have to pay out of pocket each year for covered services to help protect you from unexpected costs. Some plans offer out-of-network coverage, but sometimes at a higher cost. Remember, you must use the card from your Medicare Advantage plan to get your Medicare covered services. Keep your red, white, and blue Medicare card in a safe place because you'll need it if you ever switch back to Original Medicare. And this next sentence is so important. If you join a Medicare Advantage plan, you'll still have Medicare, but you'll get your Part A and Part B coverage from your Medicare Advantage plan, not Original Medicare. So let's dissect that paragraph. A Medicare Advantage plan is another way to get your Medicare Part A and B coverage. So a Part C plan is a part of Medicare. It's a private insurance contract with the federal government to offer you health insurance. So the definition of insurance, or insurance in general, they're risk takers. So the insurance companies take a fee to cover you in case your car gets hit by a deer like my mother, or in case a tree falls on your house like my mom's house, tree fell on it. Those are the only 2 times we ever had to use the insurance, when the deer hit a car and when the tree fell on the house. Because most of us, we're going to get our car maintained and we're going to take care of our house so that nothing happens to it. Right? Because nobody wants that unexpected expense. But when you enroll in a Medicare Advantage plans, these plans must follow Medicare's rules. And they come with additional benefits that don't come with Original Medicare. They come with Part D prescription drug plan. So if you were to be enrolled in Original Medicare Parts A and B only, you would have to add or pay a separate premium for a prescription drug plan. With a Medicare Advantage plan, it's all included. Remember what I said in the previous video. A Medicare Advantage plan is like your employer group retiree plan. In 1995, Medicare contracted with private companies to offer these plans to mirror what the employer group plans look like. So as an employer group member, you have a copay when you go to the doctor. You pay a small fee of $10, $20, $25, whatever your copay is when you go to the doctor and you leave and you have no balance bill. That is what a Medicare Advantage plan does. So you really don't have to pay more to get more coverage. You get these coverages at no cost or at low cost compared to what you would pay for a Medicare supplement. Now, a Medicare Advantage plan is going to cost you less because, let's go to the next paragraph. It says plans can offer extra benefits, which we talked about, but go to the next paragraph that says Medicare Advantage plans must follow Medicare's rules. Medicare pays a fixed amount, and if I had a highlighter, this would be one of those sentences that I would highlight. I would highlight that sentence we just went over about Medicare. If you join a Medicare plan, you'll still have Medicare, so you're not losing this card. You're not losing this card. You just don't use it when you're enrolling a Medicare Advantage plan because Medicare pays a fee monthly from what you already pay. You pay $148.50 this year. So you're going to pay Medicare for Part B. And remember, you've already paid FICA taxes, Social Security, Medicare taxes for 10 years of 40 quarter hours. And if you're like most people, you're going to work 30, 40 years before you retire and pay into Social Security. So they pay a fixed amount of that every month to the insurance companies. So what you're paying for them, Medicare is making work for you. So let's go back to that paragraph. It says, Medicare pays a fixed amount for your coverage each month to the companies offering Medicare Advantage plans. These companies must follow rules set by Medicare. However, each Medicare Advantage plan can charge different out-of-pocket costs and have different rules how you get your services, like whether you need a referral or not. So, HMOs, Health Maintenance Organization, are a type of Medicare plan you have on your job, you have with Medicare, that you have to go to a doctor that's a part of the network. Now, when we get older, we get special. We want what we want when we want it at no at no exceptions, right? So when we get older, we don't want HMOs because I want to go to my doctor that I've been going to for 20, 30 years. Well, all we have to do is check to see if your doctor is in network. If your doctor is in network, the HMO plans tend to cost less out of pocket. They have lower copays and more of those extra benefits. So HMO is a good thing if you use it properly. So I tell people, don't be like John Q. Now that's one of my favorite movies with Denzel Washington. So remember in that movie, Denzel held the hospital hostage because the hospital would not perform the heart surgery on his son because his plan, his insurance, did not cover it, right? So if you have an HMO and you go to an out-of-network hospital or an out-of-network doctor, a strict HMO only, you're going to pay 100% of those costs. That is an HMO. That's just how they made it. Those are the rules right here in black and white, right? So if an HMO is not for you, if your doctor's not in that network, there are plans called PPOs. Now we skipped over that section, but I'll go back to it. It's right here. What are the different types of Medicare Advantage plans? So we just talked about HMO. Then there are HMO points of service or These plans allow you to get services from some out-of-network, but for a higher copay or co-insurance. And they don't have any MSAs in this area, so we don't worry about those Medicare savings accounts, and we don't offer them anyway. Preferred Provider Organization, PPO plan, and a PFFS, Private Fee for Service plan. Now, when I started with Medicare, as an insurance broker, offer Medicare plans, private fee for service plans were it. They were the bomb. They were the next best thing, like a supplement, because you can go to any doctor anywhere that accepts a check from the company, and you don't have to pay more to get the care out of network. You pay the same cost in and out of network. So private fee for service plans back then were a big $0 a month. $0 a month. You try to get a private fee for service plan now, you're looking at $80+ a month for a private fee for service plan in some areas, because they don't have those restrictions like the HMOs. Now, a PPO is the middle of the road. Preferred Provider Organization plans. These plans allow you to go in network or out of network and get coverage. Now, some PPO plans, you have to pay more to get coverage out of network. But then there are some PPOs, if it's a zero copay for primary care in network, it's a zero copay for primary care out of network. If it's $15 for specialists, it's a $15 for specialists out of network. So some of them are reciprocal. They work almost pretty much just like a private fee for service plan, but at lower out-of-pocket costs and lower monthly premiums. So you are eligible for these plans. And here's the next question. People say, well, and they fold their arms like this. Well, if that plan doesn't cost anything per month, then it must not be good. Well, now, after we've educated so many people that you don't have to pay more to get more, now we can't even get people to buy a $29 a month plan. They all want zero, but that's what it used to be like back in 2008. I don't want it because it's $0 a month. Now everybody's hip to the Medicare Advantage plans, $0 a month, $10 a month, $29 a month, and it's become fashionable because more and more people are learning. But we're doing this video because there's still a lot of people who don't understand the difference between the Medicare Advantage and Medicare Supplement, Medicare Part D, and what they're eligible for. So again, if you have a highlighter, highlight this sentence. Medicare pays a fixed amount for your coverage each month to the companies offering Medicare Advantage plans. So when the companies get that fee, whether it's $200, $500, I don't know what they get, but whatever they get, when Medicare gives them that money, then they set the premium amount. And a lot of them are $0 a month, all the way up to $80, $90, $100 a month, right? But when you look at each plan, when we sit down with you and do a comparison, and we show you every plan that's available in your area, and we say this one's $0, this one's $20, this one's $0 for primary care, this one's $10 for primary care. So we do a comparison, but these plans don't cost anything because Medicare pays for you to be in it. Unlike a Medicare supplement. A Medicare supplement, which my husband covered in another video, a Medicare supplement is like that car insurance, it's like that house insurance, because Medicare doesn't pay a fee every month to a Medicare supplement. So Medicare supplement does not receive any monthly payments from the federal government, but a Medicare Advantage plan does. So therefore, the insurance companies can charge less for how you get your plan and your coverages because they're receiving something per month. So a supplement is going to be higher, like that car insurance, like that house insurance, because you're paying the full cost of the plan. So like your employer group plans, Medicare Advantage plans, have another payer. So on your job, whatever your job is, Your employer might be contributing $100 towards your premium every month, and you contribute $100. So now the company gets $200 for the plan. Same concept with the Medicare Advantage plan, Part C. With a Medicare supplement, you're going to pay that whole $200 by yourself. Plus, you have to add a drug plan. So a Medicare Advantage plan comes with drug coverage at no additional cost. Now, if you're in a Medicare Advantage plan, you're going to get what's called an annual notice of change or evidence of coverage from your plan each year. So not only are you going to receive notice of all the changes that Medicare made each year through this book called the Medicare and You Manual, but your insurance company sends annual notice of change, whether it's a Medicare Advantage plan Part C or whether it's a Medicare supplement or Medicare Part D. Most people don't open those. They don't open them. So I tell my clients, just make sure you call me between October 1st and October 10th of each year, because we cannot discuss any plan changes before October 1st. So there are some agents that are not going to follow the rules, and it makes it harder for every one of us who are following the rules. And so that's why Medicare has all these rules, because people do stuff unscrupulous, okay? So we want to make sure we follow the rules and we don't discuss those plans before we can, all right? And that's to prevent people from changing prematurely or being told ahead of time. It's like the stock market, right? So, you know, somebody got in trouble for selling stocks because they got an insider tip. So Medicare doesn't want insurance companies or agents or brokers giving you an inside trader information before your company notifies you. Okay? So you can join a Medicare Advantage plan even if you have a pre-existing condition. I'll say that again. If you have a pre-existing condition, it doesn't matter. If you're trying to get a supplement for the first time, you're guaranteed issue, so you don't have any medical questions. But if you've had Medicare for several years or even at 12 months, your guaranteed issue period is over. You're susceptible to underwriting questions. Do you have cancer? Do you have diabetes? Do you take heart medication? So there are some medical questions that you have to answer. With the Medicare Advantage plan, there used to be one group of individuals that were denied their enrollment, and that was people with ESRD. But because of the Cures Act of 2016, it now, for year 2021, allows individuals with ESRD to add or join, enroll in a Medicare Advantage plan or change their plan. They may have been stuck in a plan for years they've had before they got ESRD that they couldn't change because they were not allowed to change. But now that has changed. So you can join or leave a Medicare Advantage plan at certain times of the year. And we're going to go over that page 67 and 68. So those times of year are, we talked about the annual enrollment period. We talked about the open enrollment period, January 1 through March 31st. And then you got the special enrollment period, or what we call a SEP. Special enrollment periods includes people with diabetes. You can change plans 3 times a year, 3 quarters out of the year. You can 4 quarters out of the year. Actually, that's the only one that is allowed 4 quarters a year is people with diabetes, heart or cardiovascular issues. When I say heart issues, if you had AFib, if you've had stents or bypass or angioplasty, if you've had fluid on your heart, swelling in your legs and feet, those kind of things will give you a special enrollment period all year long where you can change once each quarter to a special needs plan. Can't get any type of plan, but you can switch for a special needs plan. Now, there are some special enrollment periods for people who are moving. Like I just enrolled a wonderful couple that just moved from Oklahoma. They just moved here and moved to Effingham County. So now I had to change them to an Effingham County plan, and they qualified for a special enrollment period. There are also people who have Medicare and Medicaid. Medicaid and extra help with your drugs, those two benefits that you get, we're going to talk about the next video, allow you special enrollment periods. So if you think you don't qualify, call anyway, because we may be able to help you. Okay? If you're not sure if you have a special enrollment period or SEP, call us and we can find out. And we may be able to create one for you also by filling out those extra benefits. Okay? And then it talks about that ESRD again. If you have ESRD, you can enroll in a plan. Your plan coverage starts January 2021. Now, if you have ESRD and you have diabetes, heart, or cardiovascular, don't fret. I just enrolled someone last night who's on dialysis and missed the open enrollment period, but they're diabetic. So I was able to put them in one of those special needs diabetic plans. So call to find out for sure. And don't listen to the street committee. Can I take a moment to pause about that? Because it just came in my head and I got to go with it. Don't listen to the street committee. The street committee will mess you up. They're going to tell you what they think they know and what somebody said. And they haven't read this book, haven't gone and met with a representative who is trained every year annually in these books. And a lot of agents are not going to go through this with you in this book. But this is how I take care of my clients. We educate them about their Medicare choices. We educate them about Medicare. So people, your street committee, you love your friend to death. She's that know-it-all or he's that know-it-all person, got all the information, the inside scoop, but they're not knowledgeable about these things. They think they know. And some of them make you think, they got their $100,000 heirs, right? But they don't have, what does that saying say? A pot to what in it and not a window to throw it out of? Yeah. So they are fake and phony, pretentious, trying to give you information to block your blessing. And that's what they do. Tell you information that messes you up. Call a real expert who can help you understand this. And again, it's not what we said, but what we read that informs you and keep you safe. Okay? So the street committee, don't listen to them. Find out for yourself. Okay? Now, each plan has different out-of-pocket costs. Many Medicare Advantage plans have a zero premium. If you enroll in a plan that does not charge a premium, that does charge a premium, you pay this in addition to your Part B. So if the plan is $19 a month, $144.80 was what they take out of your check for your Part B, and then you pay $19 a month for your plan. $19 versus $190 for a supplement. Now, this is what I tell people coming from a supplement to a Medicare Advantage plan. If your supplement plus your Part D plan is costing you a lot of money and you want to save that money, take it and do just that. Save it. So when you're coming from a Medicare supplement, take that money and put it in a separate account and don't touch it. Just let it sit there month for month for month until you need it. And you take that money from your supplement that you're saving, and you pay your copays when you have to go to the doctor, if you choose a Medicare Advantage plan. Okay? So a Medicare Advantage plan is a pay-as-I-go plan. If I go to the doctor, I pay my copay. If I don't go to the doctor, I'm not out of anything. Because like they say right there, plans, most of the plans have a zero premium. So you're not losing anything by using a Medicare Advantage plan that has zero premium. So now, the biggest cost in a Medicare Advantage plan may be the hospitalization, but all of the plans have a built-in maximum for the entire plan. But all of them have a built-in maximum for your hospitalization, where you have a cap, a limit on how much you're going to spend for hospitalization. Some of them have 5-day limits, where you're going to pay a copay for 5 days, and then after 5 days it's done, or 6 days or 7 days, whatever the amount is, right? And then you're done for the year, zero out of pocket. Some of them have a maximum limit that caps hospital, doctor, skilled nursing, whatever you have to pay for Part A and Part B, they have a cap on it. But original Medicare doesn't have a cap on your spending. And think about what I said. If you've seen my earlier video, my grandmother's bill was $39,000. So Medicare, she had original Medicare. It did not have a cap on her spending. But these plans have a cap, most of them, that's under $10,000 out of pocket. Most of them are under, some of them are under $5,000 out of pocket for your entire coverage. Whereas you're going to be paying $2,400 a year for a supplement. Save that. If you're not taking medicine, not going to the doctor a lot, so by the time you get to the point where, you know, I've got to go to the hospital, you've saved up enough money to pay that, okay? So a Medicare Advantage plan might be right for you, but a Medicare supplement plan may be better for you. And we'll help you figure that out when we sit down with you, okay? Now, whether the plan pays any of your monthly Medicare premiums. I'm going to fold my arms on this one because it says it right here that some of these Medicare Advantage plans will pay your monthly, part of your monthly Part B premium. That $148.50. Now, this was the most used line of the 2021 annual enrollment period. Okay, these companies sent out all these letters saying, call now. You may be eligible for help to pay your Part B premium, $148, right, for the coming year. So because of COVID-19, a lot of people like myself who did seminars are not doing seminars because of COVID-19. But some of these other agencies got these flyers and handouts and mailers and sent them to you and totally confused you. I've gotten so many calls of people saying, you know, this thing says I qualify for help. Well, we talked about that. Your income is over the limit for help, but that's not what they said. They said to call. That call will get them to try to sell you a plan. We don't do any cold calling. We meet all of our clients. You can see us, we can see you. So normally we meet people wherever we go at certain events, and we have a Medicare insurance drive-through as well. So we go out in the community at senior homes, high-rises, at churches, doctors' offices. We take our mobile, which you'll see on our website and on our Facebook page. You'll see we have a mobile where we can serve people COVID-free. But a lot of those mailers that went out were gimmicks to get you to call them, okay? So it says it right here that some of the plans will lower your Part B premium, but do you want that higher copay? They're going to lower your monthly Part B premium, but you're going to have a higher copay, right? So you got to learn the catch-22 of what they're offering you. That's why we go over everything in every plan that you're eligible for. We're not captive to any one company. We work for all the companies to make sure you find the plan that best fits your need and your budget. Okay? So now, Medicare Advantage plans in Section 4. If you have a question about the types of plans that you're eligible for and what Medicare Advantage plan covers, what additional benefits they cover, like the dental, vision, hearing, over the counter. And over the counter means you can get vitamins, cough drops. Some of them have humidifiers. Some of them have bathroom equipment. They have so much stuff that you can order at no cost because it comes with an allowance, a quarterly allowance for you to order those items. And again, some of them come with Part B premium reductions where they will lower your Part B premium. So if your Part B premium can be reduced, we're going to talk about it in the next video. We're going to show you how, besides these plans that offer that as an incentive. But you got to look closely. We look closely at each plan and go through it with a fine-tooth comb so that you are aware of what you're getting and what your financial responsibility is for the plan. So stay tuned and come back for the next video. Thank you so much for this magic moment.